Today with us is Professor Dr. Marc Breton from the Center for Diabetes-Technologie of the University of Virginia in Charlottesville, USA.
Yes.
Thank you for coming.
My
Mr.
pleasure, thank
Breton.
you.
Type 1 diabetes and sports are complex with this combination. Why is it often so difficult to manage for patients?
Well, we know that glucose metabolism, right, is impacted profoundly by physical activity in general and exercise and sport in particular. And it's impacted in a broad range of different ways, but depending on the duration of the activity, the intensity of the activity, the type of activity. Playing football or lifting weight is not going to have the same impact. Some activity make glucose go down, some activities make glucose go up. And so it is very, very difficult to manage in advance and to figure out what do you need to do before entering in any physical activity. There are a lot of different methodologies, some related to reducing insulin, for example, in advance. Others just taking some sugar, eating some sugar before the activity. How much is always the question, for how long if you're changing your insulin. And so there's all kind of complication, and there's a fairly active area of research around it.
You conducted a study with an insulin sensitivity informed bolus calculator used after exercising. Which results did you get in this study?
So first, this was an interesting early study, right? Only 15 people, but that was run by my mentee, Dr. Chiara Fabrice. So she's an assistant professor in our center. And that was actually her postdoctoral study grant. And so what we did together is that we developed an algorithm that looks at CGM, glucose values, every 5 minutes, and looks at insulin injection in the past, and is able to reconstruct how sensitive is the person right now, right? And so with some algorithm based on Kalman filtering, we are able to figure out how sensitive they are to insulin right now. And then what we do is we compare that to how sensitive to insulin they usually are. And if they're more sensitive than usual, we give a little less insulin. And if they're less sensitive than usual, we give a little more insulin. And so after we developed that, we wanted to test it. And so what we did to test it is that we organized a protocol where our participants were coming in the morning, we're stabilizing them. And then in the afternoon, they were exercising for about 45 minutes. And the exercise was there to create more insulin sensitivity. So we know that you're more sensitive to insulin after exercise. And so we used exercise to change insulin sensitivity to see if the bolus was able, if the algorithm was going to be able to react. And so what we saw is that it was wonderfully able to react. It profoundly reduced risks of hypoglycemia. It divided by 2 the number of hypoglycemia treatment in the hours after the meal. And so it had quite a profound effect. Now, this is not just for exercise, right? It can be used when you're more sensitive, like exercise, or when you're less sensitive. So in the next couple of years, we're going to continue to test that algorithm in more challenging situations.
Which role could measuring heart rate play in automated insulin delivery systems?
So automated insulin delivery system, or closed loop, have one big challenge around exercise. And that they're generally based on records of CGM, glucose, and insulin. So by the time glucose starts dipping significantly during exercise, it's often too late to stop the insulin and avoid hypoglycemia. So we try a lot in closed-loop system to detect exercise as early as possible. And so heart rate is one of the way we could detect exercise early. Accelerometry is also a way to do that, right? The pedometers or the usual little watch-based device. Often what works best is when you combine different signals. So combining heart rate and accelerometry is often what works best. But basically the reason it's very useful is because it allows us to detect exercise way before glucose starts going down, which allows us to act early enough.
What other things must AID systems be able to do for managing sports?
So I'm not sure anything must be done. automated insulin delivery system already manage glycemia during a broad range of activity. Now, they don't do it perfectly, but it's perfectly safe to generally use an AID in real life. What I wish we can continue to do is to explore different kind of sports, different duration of sport, competitive versus practice, and try to really validate the system further, and also include some of these exercise-informed system in the next generation of closed-loop systems, so that people have to less and less take sugar with exercise. So hopefully we can minimize that.
Thank you very much,
My
Professor
pleasure.
Breton.